My name is Joshua Cagney. I serve as the Chief Operating Officer of New Paradigm Recovery. From a purist definition, case management is simply creating wraparound services for a client that are not merely clinical but are more therapeutic. For us at New Paradigm Recovery, case management is a little bit different, and certainly there's some overlap with the idea or the concept of concierge care. It's important for us to not just treat the underlying mental health issues or trauma in order to affect change in the person's life associated with addiction, but to actually engage in a process of teaching recovery, guiding recovery, helping a person understand what life looks like once they gain the skills necessary to practice a life in recovery. So case management takes on a different role. So from a counseling perspective, my education teaches me to do one thing as a counseling psychologist, but recovery may tell me to do something very different. I can openly share about my experience. I can openly talk about my understanding of recovery and what it means to me. I can relate to clients in a way that our clinicians cannot. The net result of that is that I'm able to meet clients on a plane that is very different than our clinicians can. That's not better or worse, it's simply different. So it means that I can have conversations with clients about how they navigate conversations with their children when they try and explain what they're doing in treatment. It means that I can have conversations that incorporate how I dealt with those conversations, or conversations with employers, or conversations that may include issues surrounding security clearances or things like that. But it can also include things like goals. What do we do if we look at educational aspirations or career aspirations? How do we play that out outside of the clinical environment where it becomes much more therapeutic, where we can hypothesize and imagine what is and what is not possible? Why do I set inherent limitations on myself about what recovery should be? Case management is about breaking through those barriers and really challenging that question and thinking critically about what could I achieve if I just remove those barriers. So I think that our job in doing case management is about helping a client remove those barriers so that they really start to explore what is the best that I can possibly imagine and how can I get there. And that's often outside of the role of the clinical world. And that's what we try and focus on with case management.